Parkinson's by Haley Wingo. What is Parkinson's disease? Parkinson's is a neurological disease that affects the speech with poor articulation, weakness, and shallow breathing. The muscles are also rigid and limits mobility of the patient. The rigid muscles also does not allow for proper lung expansion, being one of the leading causes to the poor speech. So you can see over here the areas of the brain that are affected with Parkinson's. And also to this picture, you can kind of see the internal structures and what exactly is causing the poor inhalation. You can see the muscles surrounding the rib cage and why if the rigid muscles would cause poor expansion of the lungs. History of Parkinson's disease. Parkinson's has been identifiable disease for over 200 years. The first report of this disease was in 1817 by a man named James Parkinson. Later on in the same century, during the year of 1872, another man named Jean Martin Charcot worked to better explain Parkinson's and also worked diligently on expanding the early description and in disseminating information internationally about Parkinson's disease. He separated Parkinson's disease from multiple sclerosis and other disorders characterized by a tremor, and he recognized cases that later would likely be classified among Parkinsonism plus syndrome. The main research on the disease was discovered the cause for Parkinson's. The research led to discovery of lack of dopaminergic as a neurotransmitter. This leads to a medication trials to help as the neurons die in the brain because of lack of dopamine. And as you can see, this is James Parkinson over here, and this is some of the images of uh, what the Parkinson definitions and all things that were later redefined by Jean Martin Charcot. Current research of Parkinson. The current research for Parkinson is looking towards stopping the progression of the disease. The research looks to transfer brain tissue from pigs that will be implanted into people with Parkinson's. The reason why they use brain tissue from pigs is because pigs' brain tissue are known to have elements that protect nerves in them. This is important as Parkinson's is caused by degeneration of neurons in the brain. So basically what happens is the parts of the brain tissue are implanted into people who have this disease, mainly because the parts of the brain that they're using from the pigs have the ability to then protect those neurons, and because they can protect those neurons from degenerating because of lack of dopamine, then they can spare the brain and many other things that are lost with Parkinson's. Current treatment of Parkinson's. The current standard of treatment is to use a drug called levodopa, which is used to be converted to dopamine in the brain. This is the best treatment. However, the lifespan of this drug being effective for a patient is about 5 years. Surgery also is an option, like deep brain stimulation, which is where the doctor takes a metal wire in the brain, which helps control motor function. So you can see right here, this is what levodopa looks like inside the system as the medication becomes dopamine in the brain and definitely helps protect the brain as much as possible during that 5 year period. Also, deep brain stimulation, which is actually the most popular surgery done with Parkinson's, as you can just kind of see the area of where they're inserting this metal wire and kind of see where this brain is being stimulated and how effective it can be as far as motor function. Future treatment. One future treatment is the use of omega-3 polyunsaturated fatty acids have been shown to help with genes that are in the brain that are associated with inflammation. This has also been shown to help with increasing or bringing back dopamine release, which is necessary to help neurotransmission. The use of treatment can help slow down the process of Parkinson's. Future research. One future research is how far deep brain stimulation can go. Deep brain stimulation only goes to a certain point inside the brain. This research looks into how higher stimulation intensities are necessary to sustain adequate motor benefit. The question arises how far stimulation intensities can be increased before cognitive side effects become clinically remarkable. And these are my wonderful citations. Thank you so much for watching this presentation. I hope it was informative and I hope you enjoyed it. Thank you so much.